Hey everyone, Dr. Daniel McClelland here with Advance Upper Cervical Chiropractic in Walnut Creek, and you're tuning in to another episode of the Wellness Wednesday series. We do try to release a new video every Wednesday about a different topic in regards to health, spinal hygiene, and fitness. This week's topic is going to be low back pain for someone who stands a lot or is on their feet a lot during the day. I get asked this question all the time, which is it better to have a standing desk or a seated desk? And really my answer is usually the same, which is you're just as likely to create pain patterns or injury patterns from standing all day as you are for sitting all day if you are just as likely to be standing incorrectly. If you are standing in a perfect upright posture with complete balance kinetics, then there's probably not a lot of danger or risk involved with that at all. But that's not what I see for most people. When we get into a standing desk situation, we see maybe some of this or some of that. We get the hips moving in or out. And more often than not, besides just a lateral bend or rotation or something odd going on, we often tend to drop our hips and overextend at the low back. What this does is it puts a lot of pressure on your lumbar spine and your hips, which when we create that hyper curvature in the low back, that does leave a lot of room for compression, a lot of wear and tear on those joints down there. And that's usually where we're going to feel that achy pain that tends to be constant throughout the day, maybe worsens as we continue on. And so I have a couple exercises for you guys to focus on while you're at your standing desk posture. The first thing is when you're standing, and instead of letting your hips drop down and in, what I want you to do is stand nice and tall and allow for your hips to sit back a little bit. Now this may feel a little bit odd or uncomfortable for the first time, but really what you'll notice is that when the hips come in, we slouch at the low back, putting a lot of weight and compression there. But when we do a pelvic hinge, a hip hinge, that does tend to lengthen the spine, and it's going to improve the biomechanics. Even just kind of putting your hands on the muscles and feeling the difference between here and here, it will feel much more comfortable. It's a much more athletic, balanced stance. We oftentimes try to tilt up when I actually think we should tilt a little bit forward in our hip hinge. The second thing to note is where you're placing the weight on your feet. Too often, we do tend to kind of, as we come forward, we tend to lean onto our toes or the balls of our feet too much, especially if you're in a nice office setting, and women if you're wearing heels, or men if you have a shoe that has a little bit of a heel on it. That tends to shift your weight forward. And I do think that healthy exercises to kind of watch or monitor the weight on your feet. And if you start to lean back, you'll notice on your heels that the lumbar spinal muscles will disengage a little bit. For someone whose muscles are too active, creating too much tension in there, this can be helpful. So I want you to do this. I want you to put your hands on the low back muscles and feel how tight they are when you're leaning forward onto the balls of your feet, and feel how it is when you're on the heels of your feet. You'll notice that as the weight on your feet shift forward, those muscles tighten up, and when you are in a nice proper stance, kind of more on the heels of your feet to compensate for that shoe, they're going to feel the muscles release. So if you have a standing desk and you've been noticing awkward pain patterns or something have been bothering you, try those two things. Try the hip hinge and try messing with the way that you're putting the weight on your feet. See if that clears it up. If you have any other questions, feel free to ask. I'm always happy to step in and answer any questions. And thanks for tuning in. I appreciate it, and we'll look forward to seeing you next week. Again, I'm Dr. Dan with Advance Upper Cervical Chiropractic, and remember, is your head on straight? Thanks, guys.